Discuss the importance of patient positioning in radiography. How does proper positioning influence the quality of radiographic images? Answer: patient positioning is crucial in radiography as it directly impacts the quality and diagnostic value of radiographic images. Key points include anatomical visibility. Correct positioning ensures that the area of interest is optimally aligned with the X-ray beam. Properly positioned patients facilitate better visualization of anatomical structures, minimizing obscured areas that can occur due to overlapping tissues. Reduction of motion artifacts. Proper positioning combined with effective immobilization techniques reduces the risk of motion artifacts. Patient movement can lead to blurred images, complicating interpretation. Ensuring comfort and stability during exposure is vital. Optimal radiation exposure. Correct positioning minimizes the need for repeat exposures. By placing the patient in the appropriate position, radiographers can use optimal exposure factors to reduce radiation dose while ensuring high image quality. Standardization of technique. Utilizing standard positioning techniques enhances consistency in imaging across different patients. This standardization improves the reliability of diagnoses and facilitates comparative studies. Implications for pathology detection. Certain pathologies require specific positioning to reveal relevant details. For instance, oblique views may be necessary to visualize fractures or lesions that are not apparent in standard projections. In summary, patient positioning is fundamental to achieving high-quality radiographic images, which directly influences diagnostic accuracy and patient safety. Explain the concept of the dose area product DAP in radiography. How is it measured and why is it significant for patient safety? Answer: the dose area product DAP is a measure used in radiography to quantify the total amount of radiation dose received by a patient during a radiographic procedure, accounting for both the dose and the area exposed. Its significance and measurement include definition and calculation. DAP is calculated by multiplying the radiation dose, measured in gray, by the area of the X-ray field, measured in square centimeters. It is expressed in units of gray centimeter squared (GCM). This metric provides a comprehensive understanding of the exposure a patient receives. Measurement techniques. DAP can be measured using a DAP meter, which is placed in the X-ray beam path. The device automatically calculates DAP based on the dose and area, providing real-time feedback to radiographers. Significance for patient safety. DAP is an essential tool for assessing and optimizing patient safety. It helps ensure that the radiation dose remains within acceptable limits while achieving the necessary diagnostic quality. Monitoring. DAP encourages the use of techniques that minimize unnecessary exposure. Additionally, DAP data can help radiology departments establish protocols for various procedures, ensuring consistent practices that prioritize patient safety. Regulatory compliance. Many regulatory bodies recommend DAP as part of quality assurance programs. Tracking DAP helps facilities comply with radiation safety standards and guidelines, contributing to overall patient care. In conclusion, DAP is a critical measure in radiography that enhances patient safety by quantifying radiation exposure and facilitating the optimization of imaging techniques. What are the differences between direct and indirect digital radiography? Discuss the advantages and disadvantages of each system. Answer: direct and indirect digital radiography are two primary methods used in modern radiographic imaging, each with distinct characteristics, advantages, and disadvantages. Direct digital radiography (DDR) mechanism. DDR uses a flat panel detector that directly converts X-rays into electrical signals without the need for intermediate processes. Advantages: immediate image acquisition. Images are available almost instantaneously, allowing for quick diagnosis and reduced wait times for patients. High image quality. DDR typically offers superior spatial resolution and contrast, improving diagnostic accuracy. Disadvantages: higher initial cost. The setup and equipment for DDR can be significantly more expensive than indirect systems. Limited flexibility. DDR systems can be less portable compared to some indirect methods, making them less suitable for mobile imaging. Indirect digital radiography. IDA mechanism. IDR uses an intermediate step, such as a photostimulable phosphoplate (PSP) or a charge-coupled device (CCD), to convert X-rays into light, which is then captured and converted into digital images. Advantages: lower initial investment. IDR systems are generally more affordable and accessible for smaller facilities or practices. Flexible use. PSP systems are portable, making them suitable for various clinical settings, including bedside imaging. Disadvantages: longer processing time. The need for image reading and processing can result in longer wait times for image availability, potential for image artifacts. Indirect systems may be more susceptible to artifacts due to plate handling and storage. How do imaging artifacts affect the interpretation of radiographic images? Describe common types of artifacts and their potential causes. Answer: imaging artifacts are distortions or anomalies in radiographic images that can hinder accurate interpretation and diagnosis. Understanding common types of artifacts and their causes is essential for radiographers to minimize their occurrence. Common types of artifacts: motion artifacts, blurring or streaking caused by patient movement during exposure, common in cases where patients cannot remain still, e.g. in pain or pediatric patients. Beam hardening, dark bands or streaks appearing on images due to the preferential absorption of lower energy X-rays often seen in images of thick body parts or dense materials like bone. Grid lens, visible lines that may occur if a grid is misaligned or if the exposure settings are inappropriate for the grid used. Double exposure occurs when a film is exposed to the X-ray beam twice, resulting in overlapping images that can confuse the interpretation. Chemical artifacts. Improper processing can lead to streaks or spots, such as inadequate rinsing or development times that affect image quality. Causes of artifacts. Equipment malfunction. Faulty detectors or calibration issues can introduce various artifacts. Improper technique, incorrect positioning, exposure settings, or equipment handling can lead to artifacts. Patient factors, body habitus movement or foreign objects, e.g. jewelry, can contribute to artifacts. Implications for image interpretation. Artifacts can obscure or mimic pathology, leading to misdiagnosis or misdiagnoses. Radiographers must be vigilant in recognizing and mitigating artifacts to enhance image quality. Understanding common artifacts allows radiographers to educate patients on minimizing motion and to implement protocols to address potential causes, improving overall diagnostic accuracy. What is the role of contrast agents in radiographic imaging? Discuss the different types of contrast agents and their applications. Answer: contrast agents are substances used in radiographic imaging to enhance the visibility of specific anatomical structures or physiological processes, improving diagnostic accuracy. Their role and types include: role of contrast agents. Contrast agents alter the attenuation of X-rays, making specific areas more distinguishable against surrounding tissues. They are essential for visualizing vascular structures, gastrointestinal tracts, and certain organ systems that may otherwise be difficult to assess. Types of contrast agents. Iodine-based contrast agents. Applications: commonly used in angiography, CT scans, and some fluoroscopic studies. Iodinated contrast enhances vascular structures due to its high atomic number, providing excellent visibility. Considerations: risk of allergic reactions and nephrotoxicity, especially in patients with pre-existing kidney conditions. Pre-screening for allergies and kidney function is often necessary. Barium-based contrast agents. Applications: primarily used in gastrointestinal studies, e.g. barium swallow, barium enema, to visualize the esophagus, stomach, and intestines. Considerations: barium is not water-soluble and can cause complications if there is a perforation in the gastrointestinal tract. Gadolinium-based contrast agents. Applications: used in MRI rather than X-ray imaging, gadolinium enhances the contrast of soft tissues. It is particularly effective for neurological and vascular imaging. Considerations: gadolinium can cause nephrogenic systemic fibrosis in patients with severe renal impairment. The use of contrast agents significantly improves diagnostic capabilities in radiography by enhancing the visibility of structures and abnormalities. Radiographers must understand the indications, contraindications, and potential adverse effects associated with each type of contrast agent to ensure patient safety and optimize imaging outcomes. What is the significance of radiation safety culture in a radiology department, and how can it be promoted among staff members? Answer: radiation safety culture refers to the collective attitudes, beliefs, and practices regarding radiation protection within a healthcare setting. Its significance lies in enhancing compliance. A strong safety culture encourages adherence to protocols and regulations, reducing the risk of radiation exposure incidents, encouraging reporting. It fosters an environment where staff feel comfortable reporting near misses and incidents, leading to improved safety measures. Improving patient outcomes. A culture of safety ensures that patient protection is prioritized, ultimately leading to better health outcomes. Promoting radiation safety culture, training and education. Regular training sessions on radiation safety protocols and the importance of adherence can reinforce safe practices. Leadership engagement. Leadership should model safety behaviors and support initiatives that prioritize radiation protection. Feedback mechanisms. Implementing systems for anonymous feedback can encourage staff to share concerns and suggestions related to safety. What factors should be considered when determining the appropriate imaging modality for a patient, and how do these factors influence radiation dose? Answer: when determining the appropriate imaging modality, several factors should be considered. Clinical indication. The specific clinical question and the anatomical area of interest should guide the choice of imaging technique. Patient characteristics. Factors such as age, weight, and medical history can influence both the choice of modality and the associated radiation dose. Radiation dose. Different modalities expose patients to varying levels of radiation. For example, CT scans generally deliver higher doses compared to plain X-rays. Understanding these differences helps in selecting the modality that minimizes exposure. Influence on radiation dose. Selecting a modality with the lowest necessary radiation dose while still providing adequate diagnostic information is crucial. For example, using ultrasound or MRI when appropriate can significantly reduce radiation exposure compared to CT or X-ray. Relevant guidelines. RANZCR recommendations for the appropriate use of imaging modalities based on clinical guidelines describe the importance of quality control (UC) and quality assurance (CAR) programs in radiology, specifically related to equipment performance and patient safety. Answer: quality control (UC) involves the routine testing of imaging equipment to ensure it operates correctly and produces accurate results. Quality assurance (CAR) encompasses broader measures to ensure that all aspects of radiology practice meet defined quality standards. Importance: equipment performance. Regular QC checks can identify malfunctions or degradation in equipment performance, preventing poor image quality that could lead to misdiagnosis. Patient safety. Effective QA programs help ensure that imaging practices adhere to safety protocols, minimizing patient exposure to radiation while ensuring high-quality diagnostic images. Regulatory compliance. Compliance with national and international standards is essential for accreditation and reduces liability. Implementing CAC programs. Establish routine maintenance schedules for equipment. Train staff on procedures for performing QC tests and interpreting results. Review and document findings regularly to ensure continuous improvement. What are the recommended procedures for disposing of radioactive waste in a healthcare setting, and why is proper disposal essential? Answer: recommended procedures for disposing of radioactive waste. Segregation. Radioactive waste should be segregated from regular waste. Different categories, e.g., solid, liquid, should be clearly marked and stored separately. Containment. Use appropriate containers that are designed to hold radioactive material securely and prevent leakage. Documentation. Maintain accurate records of waste disposal, including the type of waste, amount, and method of disposal. This documentation is essential for regulatory compliance. Transport. Ensure safe transport of radioactive waste to disposal sites, adhering to regulatory guidelines for transport of hazardous materials. Importance of proper disposal. Environmental protection. Inappropriate disposal can lead to contamination of land and water sources, posing risks to public health and the environment. Legal compliance. Following established disposal protocols helps facilities comply with legal and regulatory requirements, avoiding potential fines or sanctions. Explain the concept of radiation hormesis and discuss its implications for radiation safety in clinical practice. Answer: radiation hormesis is the hypothesis that low doses of ionizing radiation may have beneficial effects on health, potentially stimulating biological responses that improve health and longevity. This concept challenges traditional views that consider all radiation exposure as harmful. Implications for radiation safety in clinical practice. Risk assessment. The existence of radiation hormesis could lead to reevaluation of risk models and dose limits, potentially allowing for higher acceptable limits in certain circumstances. Patient communication. Radiographers may need to explain the context of radiation exposure more thoroughly to patients, addressing concerns about low-dose procedures while emphasizing the benefits of imaging for diagnosis and treatment. Policy development. Ongoing research into radiation hormesis may influence future guidelines and policies surrounding radiation use in clinical settings, particularly in developing imaging protocols that balance diagnostic needs with safety. Current consensus. While radiation hormesis is a subject of ongoing debate, current guidelines still advocate for minimizing exposure based on the precautionary principle. More research is needed to fully understand the implications. Describe the structure and function of the kidneys in the urinary system. What imaging techniques are most effective for assessing renal pathology? Answer: the kidneys are bean-shaped organs responsible for filtering blood, removing waste, and regulating fluid and electrolyte balance. Each kidney contains approximately 1 million nephrons, which are the functional units responsible for urine production. Key functions include filtration. Blood is filtered to remove waste products and excess substances. Reabsorption. Essential nutrients and water are reabsorbed back into the bloodstream. Secretion. Additional waste products are secreted into the urine. Imaging techniques for assessing renal pathology include ultrasound, the first-line imaging modality for evaluating renal size, structure, and identifying conditions such as hydronephrosis or kidney stones. CT scan provides detailed images of renal anatomy, useful for detecting tumors, cysts, and vascular abnormalities. CT angiography can be used to assess renal blood supply MRI, useful for characterizing renal masses and evaluating soft tissue structures around the kidneys. Explain the anatomy of the central nervous system, CNS, and its implications for radiographic imaging. How do various imaging modalities assist in diagnosing CNS disorders? Answer: the central nervous system, CNS, comprises the brain and spinal cord, responsible for processing and transmitting neural signals. Key anatomical features include cerebral hemispheres, involved in higher cognitive functions, sensory processing, and motor control. Cerebellum coordinates movement and balance. Brainstem controls basic life functions, including heart rate and breathing. Spinal cord transmits signals between the brain and peripheral nervous system. Imaging modalities for diagnosing CNS disorders include MRI, the preferred modality for evaluating brain and spinal cord conditions due to its superior soft tissue contrast, aiding in the diagnosis of tumors, multiple sclerosis, and stroke. CT scan, useful for detecting acute hemorrhages, fractures, and assessing the overall brain structure, especially in emergency settings. PET scan assesses metabolic activity and can be useful in diagnosing neurodegenerative diseases like Alzheimer's. Discuss the physiological processes involved in digestion and absorption. How does imaging contribute to the evaluation of gastrointestinal disorders? Answer: digestion and absorption involve multiple physiological processes, including mechanical digestion, the physical breakdown of food through chewing and churning in the stomach; chemical digestion, enzymatic breakdown of macromolecules into absorbable units, e.g. carbohydrates into sugars; absorption, nutrients are absorbed primarily in the small intestine through the intestinal wall into the bloodstream. Imaging contributes to evaluating gastrointestinal disorders in the following ways: barium swallow enema. These studies visualize the esophagus, stomach, and intestines, helping to identify structural abnormalities such as strictures, tumors, and diverticulitis. CT abdomen pelvis provides detailed cross-sectional images of the gastrointestinal tract, allowing for the assessment of conditions like appendicitis, bowel obstructions, and inflammatory bowel disease. Ultrasound, useful for evaluating gallbladder disease and abdominal organ structures. Explain the significance of the endocrine system in maintaining homeostasis. What imaging modalities are commonly used to assess endocrine disorders? Answer: the endocrine system consists of glands that secrete hormones into the bloodstream, regulating various physiological functions and maintaining homeostasis. Key glands include pituitary gland, often referred to as the master gland. It regulates other endocrine glands. Thyroid gland regulates metabolism through hormone secretion, TNT. Adrenal glands produce hormones that help manage stress and metabolism. Imaging modalities for assessing endocrine disorders include ultrasound, commonly used to evaluate thyroid nodules or goiters, providing real-time imaging of gland structure. CT scan, useful for assessing adrenal masses or pituitary tumors, providing detailed anatomical information. MRI, particularly effective for visualizing pituitary and hypothalamic abnormalities due to its superior soft tissue contrast. Discuss the anatomical and physiological aspects of the integumentary system. How does imaging play a role in evaluating skin disorders? Answer: the integumentary system includes the skin, hair, nails, and associated glands, serving critical functions. Protection acts as a barrier against environmental hazards, pathogens, and physical injuries. Regulation plays a role in temperature regulation and fluid balance through sweat and oil glands. Sensation contains sensory receptors for touch, pain, and temperature. Imaging techniques used to evaluate skin disorders include dermatoscopy, a non-invasive imaging technique that allows for the detailed examination of skin lesions and is useful in assessing moles or potential melanoma. Ultrasound can help visualize subcutaneous structures and assess the extent of lesions or inflammatory conditions like abscesses. MRI utilized in evaluating deeper soft tissue structures, especially for assessing skin cancers that may invade underlying tissues. In the context of radiographic imaging, explain the role of infection control protocols in maintaining a safe environment for both patients and staff. What specific measures should be taken during procedures involving high-risk patients? Answer: infection control protocols are essential in radiographic imaging to prevent the transmission of infections, particularly in procedures involving high-risk patients, such as those with compromised immune systems or known infections. Key measures include standard precautions, utilizing PPE, gloves, masks, gowns for all patient interactions to minimize exposure to bodily fluids, hand hygiene, implementing rigorous hand-washing protocols before and after patient contact and using alcohol-based hand sanitizers, environmental cleaning, regularly disinfecting imaging equipment and surfaces in the imaging room to reduce microbial load, patient screening, assessing patients for infection risk factors prior to the procedure, allowing for adjustments in care protocols. By adhering to these infection control measures, radiographers can significantly reduce the risk of HAs and enhance the overall safety of the imaging environment. Evaluate the challenges associated with performing portable imaging in critical care settings. How can radiographers overcome these challenges to ensure accurate imaging outcomes? Answer: performing portable imaging in critical care settings present several challenges, including limited space. Confined spaces around patient beds can hinder equipment maneuverability and positioning. Patient condition: critical patients may have unstable vital signs, making positioning and imaging difficult. Equipment limitations: mobile imaging equipment may have lower image quality compared to fixed systems. To overcome these challenges, radiographers can plan ahead, coordinate with the healthcare team to understand the patient's condition and prepare the necessary equipment in advance, utilize flexible equipment, employ mobile imaging systems designed for portability and ease of use in tight spaces, optimize positioning, use positioning aids and collaborate with nursing staff to safely position the patient for optimal imaging while ensuring stability. Discuss the advantages and disadvantages of using CT versus MRI for diagnosing soft tissue injuries. Under what circumstances would one modality be preferred over the other? Answer: both CT and MRI are valuable in diagnosing soft tissue injuries, each with distinct advantages and disadvantages. CT advantages: speed. CT scans are faster, making them suitable for emergency situations. Bone visualization: excellent for visualizing bone injuries and fractures in addition to soft tissue. CT disadvantages: radiation exposure. Involves exposure to ionizing radiation, which poses risks, especially in younger patients. Limited soft tissue detail. Not as detailed in soft tissue imaging compared to MRI. MRI advantages: detailed soft tissue imaging. Superior for assessing ligaments, tendons, and muscles due to high contrast resolution. No radiation. Uses magnetic fields and radio waves, eliminating radiation exposure. MRI disadvantages: longer scan times. Takes more time than CT, which may not be ideal in acute settings. Contraindications: patients with certain implants or severe claustrophobia may not be suitable candidates for MRI. In summary, CT may be preferred in trauma cases where quick imaging is essential, while MRI is often the modality of choice for detailed soft tissue evaluation in non-emergency situations. MS. Thompson is a 65-year-old patient scheduled for a fluoroscopy procedure. She expresses anxiety about the process and has multiple comorbidities, including hypertension and diabetes. What steps should the radiographer take to address her concerns and ensure a safe procedure? Answer: the radiographer should take the following steps to address MS. Thompson's concerns and ensure a safe fluoroscopy procedure. Pre-procedure consultation. Conduct a thorough consultation to explain the fluoroscopy procedure, including its purpose, what MS. Thompson can expect and how it will be performed. Use simple language and visual aids if necessary. Assess medical history. Review her medical history, paying special attention to her comorbidities, hypertension and diabetes, to identify any specific precautions that may be needed during the procedure. Reassurance. Acknowledge her anxiety and provide reassurance about the procedure's safety. Offer to have a family member present if it helps alleviate her fears. Prepare for monitoring. Ensure that vital signs are monitored closely during the procedure, considering her hypertension and any potential impact of stress or anxiety on her health. Post-procedure care. Provide clear instructions on post-procedure care, including hydration, important for diabetic patients, and monitoring for any adverse reactions, ensuring MS. Thompson feels supported throughout her care. Analyze the role of quality assurance in enhancing diagnostic confidence in radiographic imaging. What specific QA measures should be implemented to monitor the performance of imaging equipment? Answer: quality assurance plays a crucial role in enhancing diagnostic confidence by ensuring that imaging equipment operates effectively and produces high-quality images. Specific QA measures include routine performance checks, conducting regular performance tests using standard phantoms to evaluate image quality, resolution, and contrast. Calibration protocols, implementing scheduled calibration of imaging equipment according to manufacturer guidelines to maintain optimal performance. Incident reporting, establishing a system for reporting and analyzing any imaging incidents or equipment failures to identify trends and areas for improvement. Staff training, ensuring that all radiographic staff are trained in QA procedures and understand the importance of equipment maintenance and safety protocols. These measures are essential for minimizing the risk of errors in diagnosis and treatment, ultimately leading to improved patient outcomes and increased confidence in the radiographic imaging process. Describe the ethical considerations related to the use of contrast media in radiographic imaging. Answer: the use of contrast media in radiography involves several ethical considerations. Informed consent. Patients must be adequately informed about the use of contrast media, including its purpose, potential risks, such as allergic reactions or nephrotoxicity, and benefits. This aligns with the principle of autonomy, ensuring patients can make informed choices regarding their care. Risk assessment. Radiographers should assess the patient's medical history, including any prior allergic reactions to contrast media, renal function, and other relevant factors. This risk assessment helps minimize potential harm, adhering to the principle of non-maleficence. Emergency preparedness. Radiographers must be prepared to manage adverse reactions to contrast media. This includes knowing protocols for immediate medical intervention, thereby demonstrating commitment to patient safety and well-being. Equitable access. Ethical considerations also encompass ensuring all patients have access to necessary imaging procedures that utilize contrast media, regardless of socioeconomic status, promoting justice within healthcare. What role does cultural competence play in radiographic practice, and how can radiographers enhance their cultural awareness? Answer: cultural competence is crucial in radiographic practice as it enhances patient-centered care and improves health outcomes. Its role includes understanding diverse needs. Cultural competence allows radiographers to recognize and respect the diverse backgrounds, beliefs, and values of patients, which can influence their healthcare decisions and preferences. Effective communication. Culturally competent radiographers can communicate more effectively with patients from different backgrounds, addressing potential language barriers and misunderstandings, reducing disparities. By providing culturally sensitive care, radiographers can help reduce health disparities and improve access to imaging services for marginalized populations. Enhancing cultural awareness, education, and training. Radiographers should participate in training programs focused on cultural competence, which include understanding different cultural practices and health beliefs. Active listening. Practicing active listening skills can help radiographers better understand their patients' perspectives and concerns. Engaging with communities. Building relationships with diverse community groups can provide insight into their unique healthcare needs and preferences. Reflection on bias. Radiographers should engage in self-reflection to identify and address personal biases that may affect patient interactions. By enhancing cultural competence, radiographers can provide more effective and respectful care, ultimately improving patient experiences and outcomes. How do ethical principles guide the management of radiation dose in pediatric radiography? Answer: in pediatric radiography, ethical principles play a vital role in managing radiation dose. Principle of justification. Each imaging procedure involving radiation must be justified. Radiographers should ensure that the benefits of the procedure outweigh the risks, particularly in children who are more sensitive to radiation exposure. Principle of optimization. The radiation dose should be kept as low as reasonably achievable, a lower principle. This involves using the lowest possible dose that still provides adequate diagnostic information, reflecting a commitment to non-maleficence. Informed consent and communication. Parents or guardians must be informed about the rationale for the imaging procedure and the associated risks. This fosters autonomy and ensures that they can make informed decisions on behalf of their children. Specialized training. Radiographers should receive specialized training in pediatric radiography techniques as children require different approaches to ensure their safety and comfort. By adhering to these ethical principles, radiographers can effectively manage radiation dose in pediatric patients, ensuring their safety while obtaining necessary diagnostic information. Explain the significance of interdisciplinary collaboration in radiography and its ethical implications. Answer: interdisciplinary collaboration in radiography is significant for several reasons. Comprehensive patient care. Collaboration with healthcare professionals, including physicians, nurses, and technologists, ensures that patients receive holistic care. This team approach can lead to better diagnostic outcomes and improved patient experiences. Knowledge sharing. Working alongside various professionals allows radiographers to share expertise and insights, enhancing overall care quality and fostering a culture of learning within the healthcare setting. Enhanced decision-making. Collaborative practice facilitates shared decision-making, allowing radiographers to contribute their unique perspectives and knowledge, which can lead to more informed treatment plans. Ethical implications. Responsibility to patients. Radiographers have an ethical obligation to ensure that collaboration occurs in the best interest of the patient, promoting the principle of beneficence. Communication and respect. Effective collaboration requires clear communication and mutual respect among team members, which upholds the dignity of all professionals involved and fosters a positive working environment. Conflict resolution. Ethical challenges may arise in interdisciplinary settings, necessitating the need for conflict resolution strategies to maintain a focus on patient-centered care. By recognizing the significance and ethical implications of interdisciplinary collaboration, radiographers can enhance their practice and contribute to a more integrated healthcare system. What are the ethical challenges radiographers may face when dealing with patients who refuse imaging procedures, and how should they respond? Answer: radiographers may encounter several ethical challenges when patients refuse imaging procedures, including respect for autonomy. Patients have the right to refuse medical procedures, including imaging. Radiographers must respect this autonomy while also providing adequate information about the potential consequences of refusal. Understanding motivations. Radiographers should explore the reasons behind the patient's refusal, which may include fear, misinformation, or cultural beliefs. Understanding these motivations can help tailor communication and support. Balancing ethical principles. Radiographers face the challenge of balancing respect for patient autonomy with the ethical obligation to provide beneficial care, beneficence. They must navigate this balance delicately to ensure that patients receive appropriate care without feeling coerced. Appropriate response. Provide information. Radiographers should ensure that patients are fully informed about the necessity of the imaging procedure, including the potential risks of not undergoing the test. Encourage dialogue. Radiographers should foster an open dialogue, encouraging patients to express their concerns and questions and addressing these appropriately. Document the interaction. It is crucial to document the patient's refusal and the information provided, including any efforts made to encourage the procedure. This documentation serves as protection for the radiographer and ensures transparency. Referral to a physician. If necessary, the radiographer can refer the patient to a physician for further discussion, especially if the imaging is critical for diagnosis and treatment. By navigating these ethical challenges with sensitivity and professionalism, radiographers can respect patient autonomy while advocating for necessary care. What is the importance of risk management in radiography, and what strategies can be employed to mitigate risks associated with imaging procedures? Answer: risk management in radiography is crucial for ensuring patient safety, improving service quality, and minimizing legal liabilities. Key reasons for its importance include patient safety. Effective risk management identifies potential hazards and implements strategies to protect patients from harm during imaging procedures. Quality assurance. It promotes a culture of safety and accountability within the radiography department, ensuring that protocols are followed consistently. Legal compliance. Adhering to risk management principles helps ensure compliance with regulations and guidelines, reducing the likelihood of legal issues arising from negligence. Strategies to mitigate risks in radiography include regular training and education, continuous training for staff on safety protocols, emergency procedures, and the latest imaging techniques helps reduce the risk of accidents. Implementation of standard operating procedures (SOPs). Establishing clear SOPs for imaging procedures helps ensure consistent practices and reduces variability in patient care. Incident reporting systems. Developing a robust incident reporting system allows for the identification and analysis of adverse events, leading to improved protocols and practices. Equipment maintenance and calibration. Regular maintenance and calibration of imaging equipment help ensure optimal performance and reduce the risk of equipment-related errors. By implementing these strategies, radiography departments can enhance patient safety and improve overall quality of care. Why are communication skills essential for radiographers, and how can effective communication impact patient care? Answer: communication skills are vital for radiographers for several reasons. Patient understanding. Clear communication helps patients understand the imaging process, reducing anxiety and ensuring cooperation during procedures. Informed consent. Effective communication is crucial for obtaining informed consent, ensuring patients are aware of the risks and benefits associated with imaging studies. Interdisciplinary collaboration. Radiographers must communicate effectively with other healthcare professionals to ensure coordinated care, share critical information, and make informed clinical decisions. The impact of effective communication on patient care includes enhanced patient experience. Patients who feel informed and involved in their care are more likely to have a positive experience, leading to improved satisfaction, reduced errors. Clear communication minimizes misunderstandings that can lead to errors in imaging protocols or patient care. Improved compliance. Patients who understand the importance of following pre-imaging instructions, e.g., fasting, avoiding certain medications, are more likely to comply, leading to better imaging outcomes. What ethical considerations should radiographers be aware of in their practice, and how can they navigate ethical dilemmas effectively? Answer: radiographers must navigate various ethical considerations in their practice, including patient autonomy, respecting patients' rights to make informed decisions about their healthcare and providing them with all necessary information regarding imaging procedures; confidentiality, safeguarding patient information and ensuring that sensitive data is only shared with authorized personnel; justice in care, providing equitable care to all patients, regardless of background, and ensuring that resources are allocated fairly. To navigate ethical dilemmas effectively, radiographers can utilize ethical frameworks, employ ethical decision-making frameworks to analyze dilemmas and identify the best course of action based on principles such as beneficence, non-maleficence, and justice. Seek guidance. Consult with colleagues, supervisors, or ethics committees when faced with complex ethical dilemmas to gain multiple perspectives and insights. What are the key principles of radiation protection in radiography, and how can radiographers apply these principles to minimize patient exposure? Answer: key principles of radiation protection in radiography include justification, ensuring that the benefits of any imaging procedure outweigh the risks associated with radiation exposure. Each procedure should be clinically justified. Optimization, implementing techniques to minimize radiation exposure while maintaining image quality. This includes using appropriate imaging protocols and equipment settings. Limitation, adhering to established dose limits for patients and staff as set by regulatory bodies to minimize the risk of radiation-related harm. Radiographers can apply these principles by patient selection, carefully evaluating the need for imaging studies and considering alternative imaging modalities that may involve less or no radiation, such as ultrasound or MRI. Use of protective equipment, employing lead aprons, shields, and other protective devices to reduce radiation exposure to sensitive areas of the patient's body. Continuous education and training, staying updated on the latest advancements in radiation protection and imaging technology to optimize practices and minimize exposure. Discuss the impact of technological advancements on the practice of radiography and the challenges they may present. Answer: technological advancements have significantly impacted the practice of radiography in several ways. Enhanced imaging quality. Innovations such as digital radiography and advanced imaging techniques, e.g., 3D imaging, have improved image quality, leading to more accurate diagnoses. Increased efficiency. Automation and improved imaging software streamline workflows, allowing radiographers to perform procedures more efficiently and manage patient throughput effectively. Teleradiography. Remote imaging capabilities enable radiologists to review images and provide consultations from different locations, enhancing access to care, especially in rural or underserved areas. However, these advancements also present challenges. Need for continuous training. Radiographers must undergo ongoing training to stay updated on new technologies and systems, which can be time-consuming and resource-intensive. Technical issues and maintenance. Reliance on advanced technology may lead to increased downtime due to technical failures or the need for regular maintenance.